Hi, I'm Dr. Steenblock, and my office is located in San Clemente, California. And today I'd like to tell you about some of the very best things that you can do to help yourself with recovering from your stroke. The fact is that when you had a stroke, there's a certain part of your brain that has been damaged and is now dead. But surrounding that dead tissue is another area that can be brought back to function, and that's called the ischemic penumbra. And started treating this ischemic penumbra, number one, by the use of hyperbaric oxygen. And that's a technique where you sit in a chamber that's enclosed and oxygen is put into the chamber. You breathe the oxygen under pressure. The oxygen in your blood goes up in concentration. It takes about 40 to 60 days of treatment, but once you go through this, you get permanent repair of that ischemic penumbra. Number two, stem cells could take the place of hyperbaric oxygen for no more cost and a very much more simple approach because all it takes is 1 or 2 shots of stem cells to give you the same results that you had when you did hyperbaric oxygen on a daily basis for 40 or 60 days. We tend to use more vigorous, stronger, healthier stem cells called umbilical cord blood stem cells. And we use those, we do those IV, and we also give them into the cerebrospinal fluid. I believe is one of the best therapies that you can do. The third thing that you can do, you can also take growth factors along with that. There are different kinds of growth factors. GCSF, granulocyte colony stimulating factor, it's an injection. You can do that, and that helps a lot. It helps stimulate the brain to regrow and helps those stem cells grow. There's another growth factor, it's called cerebrolysine, and it's a daily injection. You do it 5 days on, 2 days off for 2 months. You do that in combination with stem cells, you have a great result. Number 4 is something that's really easy and inexpensive, and that's called Stemgevity. And that's a product that I've developed, and people who can't afford to have stem cells or hyperbaric or anything else, if they just get on Stemgevity, oftentimes you see some really good improvements. Now, the dosage of it is like 3 capsules a day. You can do it cyclically, where you take more like 10 capsules a day for 5 or 7 days, then stop it for a week and then start it again. The fifth answer that I have is oxygen. Many times people who have had a stroke do not get enough oxygen while they're sleeping. And so this is called nocturnal hypoxemia. If you have hypoxia, then you can have problems with any of these therapies that we talked about. So before you do anything else, you have to have what's called a nocturnal oximetry test, and your doctor at home should be able to do that for you. If not, we can arrange for it through our office, and we then evaluate it, and if you're lacking oxygen, then you need to be on oxygen at night. If you want any further information on any of these therapies, please call the number that's listed here in the description.